Thanks so much for coming along. I'm Clarkson, the digital growth leader at Mercer Marsh Benefits. I grew up at a company called Thompson's Online Benefits for the old timers in the room. But yes, here today to talk, I suppose, my home game, which is employee benefits software, but also I think just looking at how we can leverage perhaps better or for the first time specifically around well-being as well. All right, so I've got 20 minutes. Can you start the timer so I don't... I've run through this twice and it was 22 minutes both times, so I need to shave something somewhere. And this could be the slide. So we do a big people risk report every year with our colleagues over at Marsh. I'm not going to be all doom and gloom, I promise, but I think looking at the people risk findings, it's very interesting, the big concerns and the things that are keeping ultimately HR and risk professionals awake at night. There's a lot on there and they're not all well-being related, but I would certainly call out the fact that things like mental health deterioration, I'm sure you will hear more about that in other sessions today. Things like chronic health and other things in there as well. So we know that well-being is a big challenge, and I just want to take one moment to just have a quick look at, I guess, the state of the nation. So again, you'll probably hear similar stats in other sessions potentially, but of the people risk findings, increased health and benefits costs were identified as the top global risk for employers around the world. And I'm sure some of you in the room may have unfortunately been experiencing that in your own organisations as well. We know that I think employers have been spending more and more money on general health and well-being. I think in the pandemic we saw a really big influx and a lot of new providers or existing providers, and people were just really throwing a lot of new benefits into the mix. But unfortunately, and we've touched on the medical inflation piece, that's a projection actually from our own analysis. But we know something's not working, and I know there's more sessions that are going to probably talk about this, but we know that things like burnout is significant. We know that sick days are on the increase. That's an average of 7.8 sick days per employee in the UK. Looking at the cost to the economy, so over 32.7 billion in terms of lost productivity, whether that's people who are unable to work or perhaps at work but not necessarily in good shape to be at work. Mental health, you can see, comes through very strongly as the main reason for that, but the traditional musculoskeletal is also there as well. And then finally, the NHS waiting list. So again, we talk a lot with clients at the moment about our employers taking on more of the responsibility. We need to help the NHS. I think employees are looking at their employers much more to help, prevention, getting seen quicker. We know, again, unfortunately, the trend is not particularly improving. I'm not here to talk politics, but whatever happens in a month's time, I don't think there's a magic switch anyone can throw there, unfortunately. But ultimately, all of this is impacting employers in the sense of either people not being able to work or not being seen and getting there fit and healthy again quickly. All right, just the sources. I think these get shared around, but they're all credible sources, I promise. All right, so for today, 2.5 minutes in, that's good. I don't have a silver bullet today, and I can't solve all the problems through employee benefits software, but I did just want to, as I was preparing for today, think about 3 problem statements. And again, these are not an exhaustive list of challenges that we have. But I do believe, and we have many clients that we work with and over the years, that there is still, unfortunately, often where we meet clients who maybe aren't doing certain things, there remains a lack of understanding of the wellbeing support and initiatives. Some amazing vendors here today, some new ones, some that have been in the market quite a long time. But despite that increase in spending, despite the increase in point solutions around financial, physical, mental health, we still see often when we engage with clients for the first time that they've just not been communicating those things properly. Secondly, to touch on the stigma. Now, it could be a real stigma or it could be a perceived stigma. In a way, it doesn't really matter. The truth is, if employees don't feel that they can speak up and seek help and talk to a colleague or, get that, and especially early intervention preferably, that well-being in the workplace, unfortunately, still remains a challenging subject to tackle at times. And then finally, I'll talk quickly about pathways. And again, this is around digital, this is around employee benefits software, so I will keep bringing it back to that. But actually, well-being pathways, when they're not clear, or where there's buckles in the road, if you like, I think that's a key challenge as well, because we know there are drop-off points that someone might seek information or seek help, but I'm going to just touch on how I believe digital can play a good role in making sure that pathway works. So firstly, lack of understanding. I've worked in employee benefits software quite a long time. Safe to say these platforms have evolved, right? They are much more nowadays, assuming you're using the right ones, more than a benefits enrollment tool. Some clients have put them in and they will still kind of use them fundamentally as a benefits enrollment tool. But as you can see in that slight image there, they're all mobile ready, of course, nowadays. But actually, you can have as much content as you wish on there. I think in terms of the way I see some clients using them really, really well, it's not just benefits anymore. It is that gateway to the full or the wider employee value proposition. And certainly I think well-being comes through as a very, very key theme and a key pillar of that well-being, of that value proposition. I often think when it used to be flex and benefits and well-being was probably a part of that strategy. I think that's shifted. I think that now flex and benefits are more part of the well-being strategy. That's certainly an evolution that I've seen. So again, we know that you can consolidate and create a good entry point. Holistic approach to well-being. So again, out there you're going to see, and there was people speaking earlier that I heard, some of them will try and tackle all the pillars of well-being in one place, whereas others will be more specific to a particular pillar of well-being, like financial well-being or whatever it might be. Irrespective of how you're approaching it, I think well-being needs to be holistic and it needs to be in one place. So there are different reasons someone would look to do it. But again, benefits platforms, the way we can use tiles and we can have windows and tiles behind tiles, I think is a great opportunity to do that. Ultimately, what's this about? Well, I think first and foremost, if someone doesn't know something is there and that they do not have access to it, then they're not going to engage with it because they don't know it's there. More importantly, by an early intervention, I'll touch on this later on, let's make sure people know it's there, let's make it easy and accessible. Ultimately, that's hopefully going to start to improve some wellbeing outcomes, but importantly as well, it's going to increase that return on investment from all the money, time, effort and energy that you're investing in these wellbeing solutions. This is a statistic actually taken from some research we did last year at Mercer. It's 2023 statistic, but I'll call out the second one. So this is the perception, essentially, and the answers that people gave with those who had employees who had an employee benefits platform versus those that don't. And you can see the darker blue, that's the 56% that my employer cares about me and my well-being. 82% where employee benefits software is in place. So again, while these may be originally positioned as benefits platforms, we know that when used properly, we can really move the dial. And then that the third one there, I'm thriving in my current role or organisation. Look, thriving is probably subjective, and I think there's probably different reasons and ways someone would be thriving. But ultimately, if you're unwell and your well-being is a big personal challenge, it's unlikely you would be thriving. All right, just looking at the clock, so I'm going to keep going. So I've tackled the understanding of benefits and the role, scratched the surface on the role that the software can play. Back then to stigma. So we talk a lot with clients about this as well, and I've said up there balancing empathy with economics. And I do think that it's not my phrase, I don't know where I read it, but I've pinched it. It does resonate, and again, as I was preparing for today, I think that the stigma, again, it could be real, it could be perceived, but the reality is we know that some people, for whatever reason, are still reluctant to put their hands up and perhaps just reach out and just say, you know what, I'm not doing so well over here. However hard some clients that I work with try, they still can't remove that stigma altogether. Digital, I believe, can provide great anonymity, and a lot of the providers here today will have digital solutions, right? It's kind of expected in the marketplace. Even the traditional insurers are bringing some great digital bolt-ons and add-ons. But where an employee, a colleague, doesn't want to speak to a person, we know that by, again, capturing, harnessing information, providing a gateway to it through a digital platform, some people still like talking to people, by the way, but some people may be less likely to. So for me, remember that I think that digital provides anonymity. This idea of a culture of well-being, I know a lot of you out there are trying hard and you are talking about well-being and you are investing in well-being. But ultimately, where we think about the stigma, how prominent is it in our people statements and our missions? How many senior people are talking about it? Where I've seen it land really, really well is when you get senior leaders perhaps showing some vulnerability or talking about their own health and well-being, and I'm sure some people out there today will be doing that already, but I've just seen it land really, really well. So it's not just a poster on a wall or words on a coffee cup. This is actually genuinely part of the fabric of us as an organisation, and that starts top down. So again, I'm sure some of you will have done some of this, but for those who don't, it's certainly something to consider. We know, and the evidence shows in the consulting and the broking work we do and beyond, that early intervention has a significant impact. So again, why am I talking about that here? Well, again, let's look to remove that stigma. Let's lessen that stigma as far as we can, because if that's the barrier to someone in seeking an intervention early, we know that we can start to improve wellbeing outcomes. And ultimately, back to that rising inflation on the medical side of things, it's not purely claims driven. Everything sort of around private medical delivery costs, etc., are going up, but certainly claims are not getting any better either. So it's a bit of a vicious cycle that then you get locked in, and it's very hard to control the costs afterwards. Finally, managers need help too. So I'm a people manager myself. I'm sure plenty of you in the room are as well. Mental health in particular, I think, is a very, very complex subject. Just because someone is a manager, and don't forget, often managers are pretty busy people and they're pretty stressed and they've got lots of kind of pressure on them in a managerial role by the nature of it. But I do think, and the software is interesting because it's rules-based. You know, essentially through the platform who the managers are. It's often like a category or a field in the data. So what we've seen clients do is start to isolate and create like a manager's hub or a manager's area within the platform that only a manager would see, because it's all rules-based and the content is driven by that. But don't forget the people managers. I think just because you have that responsibility does not necessarily equip you to deal with the challenges around health and well-being. This is a very busy slide, and I promise I'm not going to reel off all the stats. But this is from this year's people risk again. So just landed globally, and the UK cut actually lands at the end of this month in a week or so. I will call out, and the ones there at the top, you can see on the left-hand side that the mental health ranked as the 8th biggest concern, mental health deterioration. And again, this is across HR and risk professionals globally. We deliberately asked both. I think at the top there you can see insufficiency of employer-funded emotional wellbeing programs to meet the growing needs for support. We saw again the trends in the NHS, the waiting times in the NHS, long-term sick, all of that leads back to mental health in terms of the top trigger for that. I'm fascinated by this second one. So this tensions from different generational expectations and attitudes across colleagues. And again, talking to clients, different generations, the attitude towards well-being at work, turn that frown upside down, the old school sort of motto versus, and it's really, really acute in some organisations that we talk to. So let's maybe think about targeting different audiences, and age is an obvious way to do it, and that's probably not necessarily right. But I think until you start to tackle some of that, different colleagues in your organisations have a different opinion and view on when you're how unwell do you have to be before you don't come to work anymore. That generational difference, I think, is real. And I've actually touched on that one on the third one down, so supervisors' inability and handle employee mental health issues. I know a lot of you will have done things like mental health first aiders and again, all sorts of different solutions, but the truth is there's more work to do. All right, pathways. So where I think about pathways, and I've actually got a client example I'm going to share with you in a moment. Put simply, I think it's about removing barriers. So someone who has, let's say, lots of debt, the first thing they need to do in some cases is probably access some information. But truthfully, telling someone who's got a lot of debt, who is getting big red letter, and the numbers getting bigger every month, they probably know that debt's bad, and they know that it's telling them it's bad or saying it's really bad. That's not actually going to improve their financial well-being. What are they going to do next? What is the step or the action that they're going to take? We know that employees will feel vulnerable and anxious when they're unwell, and again, that could be different types of well-being. So, people are potentially prone to not do things. They're prone to kind of put their head in the sand potentially, and that could be physical well-being, that could be mental health, financial well-being. We've got to remove these barriers, and I think each stage of the journey needs to be connected. Benefit software, digital pathways are a very, very good way to do that. They're not the only way to do that, by the way. I'm going to come back to the managers in a moment. But you need to have a clear signpost that, okay, you're here on the journey, where you are, what do you need to do, what's the next decision, and then I've made that decision, and it's very, very clear the next step that I need to take on the pathway. Digital is available 24/7. We know that these are kind of emotive, family-based things. Often, it's not just a 9-to-5 thing that you think can deal with your well-being. Frictionless pathways, again, let's make that very, very clear, removing those barriers. Back to these people managers, people managers also need to access the right information and the right support. I think from a pathway perspective, and again, it became very real for me. So I run a team, I have people who report to me, and one of my female team members said, oh, I'm going to try and have a baby. She was quite an open book. She would tell me, fairly regular updates, and it became apparent that there were some challenges and that ultimately IVF may need to be the route that she went down. Very, very quickly, I was able to signpost her, as you would expect. We use our own benefit software, and I knew on that software, I knew there was an area, and I said, look, go on there, let's see what you can find. It'd be an interesting case study. Do we drink our own champagne, so to speak? And sure enough, she found, through a third party, one of whom's here today, some information and some support, which then allowed her to take that first step, and she was on then the pathway. Great news, it was successful. She was pregnant, very successful in that she was pregnant with twins. So she was delighted, but actually then started to feel some symptoms of pregnancy. She's a sales professional, she was a busy person and quite a chaotic kind of work schedule often for salespeople. But there was more pathways, and we were able to quickly find and signpost her to pregnancy support. It helped me because I'd never had a colleague who'd become pregnant before, so it was a case of, right, that's great, I know what I need to be doing and the support I can give as well. But also this idea of community, so that there was a signpost to other people who were indeed pregnant. Great news, the baby's arrived. I was chatting to her and congratulating her on all the rest of it about a month or so after they were born. She had carpal tunnel. I'd never heard of it, but it's really bad. Its hands tingle, and it's very, very difficult, not least when you've got newborn 2 twins to deal with. Again, directed to the employee benefits platform. We have a wellbeing area, as you would expect. That's what we do. And she was able to access information. It was a virtual GP, so again, she was working remotely by then. She was on maternity leave, but very, very quickly, with one click, she could get through and then straight onto a virtual GP. The virtual GP was great, but then it was about the PMI network. So we know that PMI have consultant networks and things. Again, all there at the click of a button, Sunday evening, whenever you're doing it. There was no need actually for her to ask me, because if she'd have asked me, I would have just probably gone on and found it in the same position. So everything at this point is done via self-service, but there's a very clear pathway that she's following. At that point, then became a PMI claim, and that's great. What's my policy number? How do I actually do the claim? Can I do it online? Do I fill in a form? Great. So a good example that really hit home to me, because again, I've been talking about this stuff for quite a while, a really great example, and that's one example, and that's not that niche, but that's one pathway. There are multiple pathways for well-being, all sorts of different things, but a great case study, I hope. Still doing okay for time. This is a stat from our 2023 survey about global talent trends. So we do lots of great research for anyone who's interested across all sorts of different things. And just as I was sort of thinking, well, how do I wrap up this talk today? So I've talked to you about employee benefits software, some of the, scratch the surface in a way on some of the role and the pathways and the understanding, and perhaps removing some of the stigma. But where I see wellbeing work really, really well, and you don't have to work with one organisation, but I guess the good thing about us is we have the depth and breadth. And we do see a trend, and while it's only 58%, there's a lot of organisations out there, this idea of consolidating consulting, traditional broking and digital all in one place. And we are definitely seeing that trend. So look, we may have touch points with some of you already, but please don't forget, we do lots that we probably aren't talking to you about as well. All right, so I'm actually within time. I'm doing well. So key takeaways, I think you get all the slides. We are here, so please come over and have a quick chat if anything's particularly resonated with you. Again, I don't get long, and I try and cover a bit of ground in these. But key takeaways, I suppose if you remember nothing else, a lot of you will have employee benefit software, I imagine, today of various shapes, sizes, colours, functionality and things. But this is very much a wellbeing day, as we know, but do think, perhaps reflect on how you're using it, if at all. You may have wellbeing over here. One of our big automotive companies, they've done this amazing microsite and all this great wellbeing stuff, but it does sit over there. And actually, in terms of a gateway, I think you need to be really, really clear and get people to it. So it can increase employee understanding. It's all rules-based again. You can show different audiences, different things. Don't forget that too. Removing wellbeing barriers, whether that's just not understanding how to access it, or again, perhaps providing that anonymity I've talked about. You'll hear more, I'm sure, from other people about that today as well. And ultimately, it's about pathways. So I gave you the example there, but just leveraging it. And employee benefit software can't do it all. It is not a single silver bullet for all things well-being. But what it can do is it can centralize things, and it can clearly signpost, single sign-on. It can become that focal point that you then go where you need to, depending on which pathway you're taking on the well-being journey. And that's our slightly salesy benefits that truly benefit thing. 24 seconds left.
Thank you very much, Guy. And because we're going to a break, let's take the advantage to pick up a couple of the Slido questions. So one of them, in some companies, not everyone is connected. So how do we complement the digital tool or make this accessible to them?
Yeah, really good question. I was talking to a prospective client actually a couple of weeks ago. So 70% of their people didn't have a company email address. They never had a technology touch point at work. Ultimately, the 99.9 something percent of people in this country have a mobile phone. Again, some people don't though. I think you've got to think about communication channels. Digital is a great channel, and it's a mass channel in many ways, but let's not neglect people who either don't like digital, aren't comfortable with it, or don't have a smartphone to the point where you can even communicate to that level. So yeah, you do need to mix your channels. One thing I've seen work really, really well is QR codes. So I don't know if you guys use those, but where you have those bigger offline populations, even if it's not their smartphone, but it's family members, like e-brochures, all sorts of cool stuff you can do, and it could be left in a staff room on like a postcard, essentially. I've seen that work well.
And this is a really big question, but let's run it anyway because we're moving into a break in a moment. What tips do you have for helping managers join the dots between the different benefits for their team members?
Yeah, I've seen it done different ways. I think some people, again, looking through an employee benefits lens, we have tiles, we have different areas within the site that you can go to. The thing about wellbeing, again, it has to be holistic, and they're not mutually exclusive, of course, because if you've got financial stress and pressures, that could have mental health implications and behavioural implications that impact your physical wellbeing. So you've got to start quite holistic, but then I think it's about honing down, and again, it's pathways to say, here's all the health and wellbeing and those 4 key scenarios, generally mental, physical, financial and social. Are you there yet? And we are also doing things like leveraging AI. I couldn't stand up here and not say AI at least once, but it's going to be super clever. It's not there yet, but it's going to be a really, really intuitive way of guiding that as well. Firstly, just get it all in one place. Try and put it in buckets. It's a bit crude, but then you've got to just, because there's too much of it otherwise. You know, look out there, right? There are brilliant providers out there, but you know, you've got to bring it into one place.
Fantastic. Thank you so much, Guy.
Thank you again.